Hello, my name is Jennifer Wright. I'm a student at Roberts Wesleyan University in the Masters in Nursing Leadership and Administration program. This is my presentation on utilization of nursing informatics and data-driven wound care. The use of data in nursing plays a critical role in improving the quality and safety of patient care within wound care clinics. Data supports evidence-based clinical decision-making by allowing nurses and providers to evaluate wound measurements, monitor healing trends, and assess patient outcomes to guide individualized treatment plans. Accurate data collection and documentation also enhance continuity of care by improving communication among nurses, physicians, and interdisciplinary healthcare teams through the electronic health records. In addition, analyzing patient data helps identify trends and gaps in care, enabling healthcare organizations to implement targeted interventions that improve patient outcomes and reduce complications. Data-driven practice further promotes patient-centered care by tracking healing progress, evaluating treatment effectiveness, and recognizing social determinants that may impact wound healing. Finally, the use of standardized data supports accountability, consistency, and adherence to best practices across wound care settings, ultimately contributing to safe and higher quality patient care. Nurses play a vital role in collecting structured clinical data during every patient encounter, including wound measurements such as width, depth, and length, as well as exudate type and amount. When documented in standardized flow sheets and electronic health records, this raw data is transformed into meaningful clinical information that helps establish patient baselines and monitor healing progress over time. By comparing visit data with evidence-based clinical guidelines, nurses can determine whether a wound is healing appropriately or showing signs of delayed recovery. Through critical thinking and clinical judgment, nurses use this information to guide personalized treatment plans, improve patient outcomes, and support safe, high-quality wound care. Standardized quantitative tracking in wound care helps reduce treatment inconsistencies and improves the overall quality and safety of patient care. By using measurable data points, nurses and providers can objectively evaluate wound healing progress and determine the effectiveness of interventions such as debridement, compression therapy, and offloading. Data-driven assessment tools provide immediate numerical evidence of treatment outcomes, allowing clinicians to make timely and informed decisions regarding patient care paths. This approach also minimizes reliance on subjective observations, replacing statements such as "the wound looks better" with precise, evidence-based clinical measurements that support consistency, accountability, and improved patient outcomes. Monthly healing reports track wound healing trajectories across diverse etiologies, including diabetic, venous, arterial, and pressure wounds, enabling our nursing staff to measure localized clinical outcomes against national healthcare benchmarks. These reports also identify systemic bottlenecks and flag wound categories that may require adjusted treatment modalities. By synthesizing electronic health record data, these monthly reports offer granular visibility into healing rates, exudate levels, and tissue composition over time. This structured feedback loop empowers nursing leadership to implement targeted, evidence-based interventions and standardized care protocols in the wound care clinic. Furthermore, by cross-referencing localized healing trajectories with demographic and comorbidity data, the nursing staff can proactively identify high-risk patients who are deviating from expected healing curves, allowing for early interdisciplinary intervention. Beyond immediate clinical adjustments, the insights generated from these reports serve as a vital catalyst for interdisciplinary collaboration, bridging the gap between nursing staff, vascular specialists, podiatrists, as well as nutritionists. This comprehensive overview ensures that systemic issues such as nutritional deficiencies, offloading noncompliance, or compression noncompliance are addressed alongside topical wound care concerns. Ultimately, integrating these national benchmarks into monthly reviews fosters a culture of continuous quality improvement, significantly reducing hospital readmission rates and optimizing long-term patient recovery outcomes. Utilizing the visit-by-visit progress grid, our nurses and providers can track wound measurements and drainage levels at each visit to determine if the wound is healing and decreasing in size or worsening and increasing in size. Standardized clinical guidelines recommend that if a wound fails to shrink by 50% within a 4-week window, the nurse should discuss with the provider for alternative advanced treatments. Based on these trends, the clinical team will decide whether to maintain or adjust the current care plan. When a chronic wound fails to meet the 50% reduction threshold within the critical 4-week benchmark, it often indicates underlying cellular or systemic impairments that standard dressings cannot overcome. In these instances, the transition to advanced treatment modalities becomes necessary to restart the stalled healing process. Providers may consider integrating bioengineered skin substitutes, cellular and tissue-based products, or negative pressure wound therapy to actively stimulate the granulation tissue. Additionally, advanced modalities such as hyperbaric oxygen therapy or specialized enzymatic debridement may be introduced to address deep-seated hypoxia and persistent necrotic tissue, effectively shifting the wound out of its chronic inflammatory phase. These visit grids prevent nursing teams from prolonged reliance on ineffective wound treatments by capturing discrete shifts in patient-reported pain, localized heat, wound size, arrhythmia, and foul odor. These grids allow clinicians to intervene before severe complications develop. The systematic tracking of these subtle clinical markers, such as the escalating arrhythmia, foul odor, wound size, and localized warmth, serves as an essential warning system for bioburden shifts and impending wound infection. By catching these micro-level trends during routine visits, nursing teams can differentiate between expected inflammatory healing responses and active bacterial colonization or biofilm formation. These proactive identification allows clinicians to order wound cultures, initiate targeted antimicrobial or antiseptic dressings, or begin systemic antibiotic therapies well before localized tissue escalates into cellulitis, osteomyelitis, or a life-threatening sepsis. The visit-by-visit progress grid is more than just an internal nursing and provider utility. Sharing it with patients directly enhances their understanding of treatment goals. Seeing clear visual evidence of wound shrinkage significantly improves patient adherence to complex care protocols, including offloading footwear, compression wraps, dietary changes, and home dressing routines. Chronic wound healing is often a grueling, slow-moving process that can take an immense emotional and physiological toll, frequently leading to patient burnout or feelings of helplessness. By providing undeniable visual proof of incremental shrinkage or reduced fluid drainage, the progress grid serves as a powerful psychological motivator. even micro successes, which might go otherwise unnoticed by a frustrated patient, become highly visible milestones that validate their patience and hard work. This positive reinforcement reduces treatment fatigue, boosts morale, and instills a renewed sense of agency, ensuring long-term adherence to intensive therapeutic regimens that are vital for complete wound closure. Utilizing data that shows us our healing rates dependent on wound etiology, we can also generate the monthly healing report by wound etiology. By polling reports of healing rates across various wound etiologies, allows our clinic to benchmark our performance against national standards consistently. This continuous data tracking not only ensures that we maintain high quality clinical outcomes, but also helps identify specific areas where protocol adjustments or advanced therapies could further optimize patient care. Ultimately, these benchmarks validate our clinic's efficacy to stakeholders and reinforce our commitment to evidence-based practice. Our wound care optimization workflow operates a continuous, data-driven cycle designated to bridge bedside care with clinical leadership. It begins at bedside with the documentation, where nurses capture exact wound dimensions during the patient's initial visit. Once this is documented, the system moves to analyze, where the progress grid automatically calculates the rate of wound healing reduction, triggering clinical pathway alerts if healing is stalled. Over time, this individual data transitions to aggregate as clinical registries compile these metrics into monthly healing rates categorized by specific wound types. Finally, the cycle reaches optimize, where leadership reviews these high-level trends to modify treatment protocols and targets lingering clinical gaps with specialized training, ultimately driving better outcomes back at the bedside. And these are two references that I used for the presentation.